Dr. Nami, how does your jaw position actually affect sleep apnea?
Well, jaws are really important because when we look at the functional airway, again, it's through the nose, through the back of the throat, and down. And so this jaw is this floaty thing that's held together by your TMJ. And so if it's too far retruded, like the chin is too far back, it can make sure that your airway is super small and impinged, which causes sleep apnea. And the obstruction can be like one of the things. The meaning of obstructive sleep apnea is there's an obstruction. Typically, it's the tongue muscle that's going to be obstructing the windpipe because that's what's nearly connected. But connected to the tongue muscle is your jaw muscle or your jaw bone. So we want to look at the jawbone and make sure that it's in the correct physiology or in the correct anatomy to make sure that you don't have an obstruction.
Are there any issues with your jaw, like opening, your mouth opening during the night, that sort of maybe might make you sleep, and be breathing through your mouth as opposed to your nose because your jaw is opening? And is that because of, weak jaw muscles?
Yeah, well, actually, the biggest thing is there's going to be weak jaw muscles because the tongue is what activates the muscles of the myology here. Now, in patients who actually have a weak muscle, we're actually going to see stronger jaw muscles because they're clenching and grinding their teeth. And the reason why they're doing that is the tongue falls back and obstructs the airway. Your autonomic nervous system, which is your skeleton and your heart rate, right? It doesn't want to wake you up because you're sleeping. What it's going to do is try to fix the problem on its own before it tries to wake you up. So what it's going to do is make you grind your teeth. So that's why people with sleep apnea always have a grinding problem. If you've ever seen, sorry, go ahead. If you've ever seen people with really small teeth, their teeth are worn down in the back, it's because they have a massive airway problem. Your body is going to naturally produce this response. It's already in us. Our body is physiologically designed to be able to do that. And so what we typically see is a lot of muscles. If you see somebody with like really big jaw muscles, you can probably bet on them that they've chipped their teeth, they have ground their teeth down. And that's why these are all problems we see with patients with sleep apnea. Chipping and breaking teeth, gum recession is what I typically find. A ton of crowns, and they're like, I don't know, I keep breaking my tooth or I keep breaking my crown. And it actually has to do with an airway issue. The jaw is actually, the positioning of the jaw isn't proper. The tongue isn't also proper. Well, and sometimes people have this because the jaw position is too retruded. So the way that Dave excuse me here, I have a little tongue twister. The way, if you look at my chin here, see how it's further out? There are people who have a chin that's really retruded, so their jaw is really like this. When their jaw is really like this, it becomes a real problem because if I do this, I'm going to make this area, which is my functional airway, even smaller. And that way it's easier to obstruct it. So people with, genetically sometimes have this, or people who've had braces sometimes have this. The jaw didn't get an opportunity to develop properly. If they have an underdeveloped jaw, they'll also end up with sleep apnea.
Are there any jaw exercises that you can do that might help improve your sleep apnea symptoms?
Yes, absolutely. The muscle, well, when you do the myology exercises that we have for the tongue, it's automatically going to move the jaw. So as soon as you exercise the jaw in the proper place, it will definitely help with sleep apnea. The only thing is, I don't recommend just jaw exercises. I would recommend jaw exercises plus tongue exercises. If you do both of those, it'll make a difference. And the jaw exercises would be easily with putting a knuckle in your mouth. Mm-hmm. And then two knuckles and then three knuckles to expand that jaw. Because people who actually end up having a lot of sleep apnea end up with a lot of grinding and TMJ, and as soon as they wake up in the morning, sometimes their jaw is locked. So it's opening that properly, and that jaw gets stuck in the wrong spot. So really sliding it out properly makes a huge difference. So that's what we actually recommend for patients who have a jaw issue. There are also devices that move the jaw forward like that, and it ends up causing TMJ issues. So I want to make sure that people are well aware. not to do those. It is, the thing that we've done in medicine for the last, gosh, 30, 40, 50 years. Now there are better products out there for you. So I would urge you not to move that jaw forward because it will cause TMJ problem. It'll stretch that jaw too
Is
far.
there anything else, besides these exercises that you can do to change your jaw position and help to prevent sleep apnea?
Absolutely. In the past, the only option to move jaw position was surgery, and we now had non surgical appliances that can help move the jaw in the proper place, which is really great because it actually adds, a great option for patients who want to make sure that they can fix their jaw, but not have to go through surgery. And one of the things that we do is expand the jaw bone. We can do that through appliances, which makes more space for the functional airway, also makes more space for the tongue, so it's in the proper position. Also, it stops patients with people who have like ringing in the ears or hissing sound or vertigo. It helps get rid of all those symptoms that patients have had. So there's definitely appliances that we can actually utilize in order to help our patients. We have to figure out which one we want to use. And so, first thing we always recommend is CT scan and an analysis to figure out exactly which appliance is going to be best for the patient. And then that way we can provide the right appliance to make sure that they're very comfortable.
And how long does it typically take to see results from an appliance treatment like that?
If it's a occlusal splint, within about 6 weeks, patients will see differences. Even doing the myology exercises, within 3 to 6 weeks, patients feel a difference. With the splints, within 6 weeks, they'll feel a difference. Sometimes some cases take about 2 years. If there's a vertigo, if there is hissing sounds and things like that, because a nerve is compressed, it takes a little bit longer to heal the nerve. So that one takes a little bit longer, but patients could see difference in 3 to 6 weeks.
And are there any potential side effects?
No, there are no side effects that are negative to doing these things. When done properly, everything that we do actually yields a positive response. And the beauty of this is when we put our TMJ or our jaw in the right position, it actually helps lower inflammation of our body because it puts our body into that rest and digest versus the fight or flight response.